from the American Academy of Pediatrics.
It's been about 3 months since the measles outbreak started, and unfortunately, it shows no sign of slowing down. As if the virus itself spreading wasn't bad enough, we have also seen pretty bad false claims spread quickly online. Today, we're doing our part in answering some of the most common things we're hearing with accurate information.
One of the things that measles virus does is it actually infects the memory B cells in our immune system. Those B cells are our memory for all of the infections that we've had previously. So not measles, but when we've had flu, when we've had RSV infections, all the things that your kids have endured during their childhood, if they get measles, it wipes out, it erases all of that immunologic memory.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho-Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions, and the answers will hopefully be even better. Let's get started. Today, we're joined by Dr. Ari Brown, who is a pediatrician based in Austin, Texas, and the author of Baby 411. You may remember her from our episode on potty training, which turned out to be a really fun conversation. Today, though, the topic is not fun at all. Ari, thank you for joining us again.
Oh, thanks so much for having me. I'm excited to be here.
Ari, you practice in Texas, the state at the epicenter of the measles outbreak. What kinds of questions are you hearing from parents right now?
Yeah, this is a tough time to be a pediatrician anywhere, but particularly in Texas. And so I have lots of families that are scared and worried, and they want to know, can my kid go to daycare? Can we go on play dates? Is travel okay? And a lot of my patients, the question has been, can we get the vaccine early? And what do we look for? And what do we do if we're worried our child has measles?
Yeah, it's so much. Ari, to take a step back and knowing that this is a moving target, what is the latest update on the number of cases?
Well, as of April, we're at over 800 cases nationwide, and 3/4 of them have been in Texas, but several other states have cases. And obviously this number is evolving and it's continuing to rise. And so this year is actually the second highest year as far as the number of cases since the U.S. declared measles eliminated in 2000.
Which is so heartbreaking, right? As a pediatrician and a mom, it's heartbreaking. There's no other way to put it. All right. There are a lot of false rumors, as we mentioned at the top of the show, that are being spread online about measles and vaccines. It can be really overwhelming. So for parents who are listening, what is the best way to tell the difference between fact and fiction?
Absolutely. And I will say, whether it's measles or anything else, I think it's really important to be a fact checker. You can look at some information, but then always be sure to verify it. So the very first place to start is, who's the source? Where is this information coming from? Do you know who this source is? Do you know who the author is of the person that's writing this content or sharing this information? And certainly everybody's entitled to their own opinions, but not their own facts, right? So we want to make sure that this is fact-driven information. And the best way to know if something is truly a fact is, does the person who's sharing this information, are they fully transparent? Are they sharing the data? Can you go to the sources that they're quoting or citing in the information that they're sharing? And when it comes to science, if you dig even deeper, are these sources that are from published, peer-reviewed sources? And quite honestly, that can be difficult for a non-medical person to discern. I mean, we as pediatricians know what reputable journals are, but there are some, what I will tell you is pay to play, where if you throw money at some, pseudo journal, they will publish whatever. And so you have to know the source. And the other thing that I always tell people is that good science is replicated and it's confirmed from different researchers who all find the same result. So if you find one nugget of information that's concerning, see if you find that nugget lots of other places, because that should reassure you a little bit that it's probably more reliable information.
Yeah. And along the same lines, Ari, what are some red flags that what you might be looking at on your feed, right, is false? What are some red flags that should make you stop and say, this is probably not true?
First thing is, I would say follow the money. If this person is sharing content with you and then they have the secret answer to protect you or your child from this illness, or they're selling you some sort of a supplement, I would be suspicious about why that information is being shared, and then try to figure out, why does this person care? I would say us as pediatricians, our goal at the end of the day is to advocate to protect the health of children. And that is why we care. But if you're looking at something and they're sharing information that is scary to you, why does this person care? So you got to know, who is the author, who's the source, follow the money, why do they care? And there are places you can actually go to do some fact checking. Factcheck.org is a place that will actually fact check for you. And then there's another website called infodemiology.com, which also from a public health space is actually monitoring content, which can also help tease out what's fact and what's fiction.
I love this. And the AAP itself has a new website. If you Google AAP fact checked, you can also find some resources that really fact check some of the things that are circulating. And I really hope the parents listening will go to those sites when something doesn't feel right. Now, Ari, say that it's not necessarily that you have heard something online that you're worried and you're wanting to fact check, but you just want to learn some basic things about measles and vaccines. What are some trusted sources that parents can go to?
Right. So the very first place is the AAP, and it is rich with content, let me tell you. So there are actually two different websites that the AAP owns. And so one is healthychildren.org, which is great for parents because it's very easy to navigate. AAP.org also has a lot of content. It's a little bit geared more for pediatricians, but you can access both and get a ton of information. The other websites that I like to send people to are immunize.org, and then Children's Hospital of Philadelphia, which is chop.edu, Vaccine Education Center. If you Google that, you should be able to get a ton of information on vaccines specifically. And then I will say that one of my passion projects that I've been doing for the past 20 years is my book, which is Baby 411. And I update that book every couple of years. And it's been a joy to know that I've helped so many families who are seeking fact-based, science-driven information. And so it's got a nice section on vaccines as well as everything else. But know that, again, what good science is science that is replicated and that everybody comes to the same conclusions. And so it's always good to look at several sources to tease out what's fact and what's fiction.
Yeah, so many good resources out there. And, if you prefer your information on social media, which no judgment, I've come to accept it. The AAP and Healthy Children are also on social media, which we've plugged on this show many times. Now, Ari, one term that parents might have heard in the news lately is immune amnesia. Can you explain what that is? How can a measles infection impact the immune system's memory?
Measles virus is a very interesting and scary virus for a lot of reasons. And one of the things that measles virus does is it actually infects the memory B cells in our immune system. Those B cells are our memory for all of the infections that we've had previously. So not measles, but when we've had flu, when we've had RSV infections, all the things that your kids have endured during their childhood, if they get measles, it wipes out, it erases all of that immunologic memory. And so it leaves people susceptible to other infections for months and sometimes even years after they've had a measles infection. So measles is kind of the gift that keeps giving. First, you get the infection. And if you survive it, because there is a risk of death from measles, and that's one of the scary things about measles itself. But the other piece is that it can actually impact your immune system for quite a while.
Yeah. And you say all the things that you have endured, right? And I'm having flashbacks to the first year of daycare and the time we were home for a week with hand, foot, and mouth, and the time we caught RSV and had a complication, and all these other things. And I'm just thinking, oh gosh, for someone's immune system to go back to not remembering those infections and to being potentially susceptible to catching them again after they've already had them. I mean, just so scary. And really, as you said, the gift that keeps on giving, right? All right, I want to bring up what for many people is a sensitive topic, not for all, but for some. One of the most prominent conspiracies about the MMR vaccine, as you know, is that it causes autism in children. As pediatricians, we know that this is not true, but some parents may have heard these false rumors and might be hesitant to vaccinate their child. What do you say in your practice to parents about the MMR vaccine and autism?
Oh my gosh, so much to say, right?
Right.
And feel free to jump in and share your stories as well, Edith. But, I think there's some things that I want to say at the very top that are probably the most important things for families to hear. And the first is that if there was actual data that demonstrated proof of a connection between this vaccine and autism, pediatricians would be the very first in line to sound the alarm, because our patients are our kids. We truly treat our patients like our children, and we would never do anything that would impact our kids. And to take that a step further, many of us as pediatricians are parents ourselves, and we vaccinate our own children. And when parents ask me about vaccines, I can give them all the science and explain all the data. But at the end of the day, my very most important point to bring up is if I was worried about vaccines, I wouldn't give them to my own kids, and I wouldn't give them to myself. And let me tell you, I was the first in line to get COVID vaccine for myself. My kids got their entire vaccination series, and I would do it again in a heartbeat. So know that, we trust vaccines, and we also, our goal is to take care of patients, and we do really treat them like family. So that's the most important thing. But breaking it down into more of the science, vaccines have really received intense scrutiny over the past 25 years. And there's been this very important search for what is the cause of autism. And the best scientific minds worldwide have looked for a link between vaccines and autism. And no one has been able to find it. And again, good science leads to the same results. And so when you have this many global experts looking and not finding this conclusion, science has come to the table. The question has been asked and it's been answered pretty thoroughly. And so there is no link. There is not a link between this vaccine or any vaccine in autism. But unfortunately, this myth is, kind of coming back right now. And there is, a search for answers. What I will say is this, is that it's important to look at the science. And when you have a hypothesis and you're looking for an answer that you already want to find, that's very different than looking for an answer. And I think that it's very important to look for answers with an open mind. And science has done that already very effectively. But I think that the greatest gift that I can offer my patients is the gift of protection. And I think that this whole kind of myth, as you say, about the vaccines and autism somehow gives parents a false sense of hope that somehow not vaccinating is somehow going to protect their child from autism, which is completely untrue. It just leaves them at risk for getting vaccine preventable diseases. And I promise, as somebody who has taken care of patients who have gotten very sick and actually have died from diseases that are preventable by vaccine, I promise these are not diseases you would ever want your child to have.
All right, that point that you just made, I don't think I had really thought about before. And it's this idea that by telling parents that if they don't vaccinate, they can prevent autism is false hope. right? We know.
Right.
We know that there is no link. And, I've been asked by friends, family members, but do we really know? And the answer is yes, we really do know. The science is very, very clear. And as you said, sometimes given that sense of, in my personal life with my own precious little child, this is what I have chosen to do. Couldn't have said it better. All right, as you know, the measles vaccine was introduced in 1963. Most pediatricians in practice now have never seen a case of measles before, myself included. We know you were not around back then either, but can you give us some historical perspective? What was the world like before vaccines were widely available, and how have they changed the world for the better?
Well, I hate to tell you, it is true that I was born in 1966. However, I was in medical school in 1989 in Houston, and there was a measles outbreak, and I have seen measles. And I promise you, those kids, they were sick. And again, it is not a disease that you would want your child to have. And so when people say, oh, I'd rather get measles or I'd rather have my child get measles, that feels like the safer choice. It is not. If you have seen measles, you can't unsee it. But to your question is, what did the world look like? I also am old enough to have watched a few diseases go away. So at the time of medical school, doctors that were coming out of training just before me were still seeing Haemophilus influenza B, meningitis, Hib meningitis. And that vaccine came out while I was in medical school, and I watched that disease go away. The same is true of chickenpox vaccine that came out in 1995. And unfortunately, I took care of a patient who had chickenpox and died. And it was literally 4 months before the vaccine came out. And that's something that I will never forget. So these diseases, the reason why we have vaccines for them is they are really serious and can be deadly or can lead to lifelong consequences. And so, if you go to an old graveyard, if you look prior to 1900, the past century has been amazing as far as diseases that we can protect against, including 3 different forms of bacterial meningitis, right? But if you go to an old graveyard from the 1800s, you'll see that families would have 7 or 8 kids, and half of them would die in early childhood due to diseases that we now protect against. And so my favorite mantra is to say, let's prevent what's preventable. And these are diseases that we can prevent. And that's why these deaths from measles have been just so incredibly tragic, because it's horrible for a child to die. And then on top of that, to know that it is preventable.
Yeah, let's prevent what is preventable. All right, as we come to the end of our show, I'd like to end our episode with what we call a parenting prescription. So when it comes to vaccines and measles, what is one thing you want all parents to know?
Wow. So I think the key to vaccine success is that everyone in the community gets vaccinated. And that is one of the things that we're seeing with this measles outbreak. It just points out the fact that vaccines really work best when the community has immunity, and germs don't play politics.
Yep, they sure don't. Thank you so much, Dr. Ari Brown. This was such a joy.
Thanks so much for having me.
And thank you at home for joining us. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on YouTube, Instagram, Facebook, and Threads at Healthy Children AAP, and be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Laura Alessio,
Catherine Beard,
Garrett Brown,
Zach Christman,
Ann Johnsos,
Kathy Jewell,
Claire Keating,
Doug Nagel,
Jackie Ortega,
Susan Stevens Martin,
Mary Claire Walsh,
Hannah Weston.
And our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bracho-Sanchez. Thanks for listening.